AIDS and HIV. The AIDS is acquired immunodeficiency syndrome. AIDS is a chronic, potentially life-threatening condition because it's incurable. The causal organism of AIDS is HIV, human immunodeficiency virus. Its genetic material is RNA. This virus cause in cause HIV infection. The HIV infected person may or may not have AIDS. This virus kill T4 cells, these are immunity cells, and patient become immunodeficient. The person becomes susceptible to the AIDS. The symptoms of the AIDS are weight loss, fever, night sweat, diarrhea, fatigue. The progression of HIV progression in a four stages. First stage is exposure. When a healthy person come in the contact of infected person, the exposure period is 3 weeks to 3 months. The next stage is asymptomatic condition. In this condition, there is no symptoms and person become HIV positive and AIDS negative. This period may occur 5 to 10 years. The next stage is symptomatic condition. In this condition, the symptoms are arises like fever, fatigue, weight loss, night sweat, diarrhea, and the next condition is AIDS. The patient become AIDS and death occur in 1 to 2 years. HIV is spread when an infected body fluid introduced directly into the body of an uninfected person. The mode of transmission is actually the fluid is transmitted sexually, so that this disease is called sexually transmitted diseases, STD. Sharing equipment like syringes and other surgical equipments and drugs, infected mother to child, blood transmission and breastfeeding. The risk of HIV transmission depend on the concentration of HIV in the infected fluid, the quantity of fluid introduced the body, the access of the infected fluid to the T4 cells. The high concentration of HIV fluids are semen, blood and blood component, menstruation flow, vaginal secretion, breast milk. The risk of HIV can be reduced by the safer sex barrier method during the sex. The window period, this time between infection and first test become positive. During this time, the person is infected even through this test the tests are negative. The window period is 6 weeks. The treatment, it's an incurable disease. There is no treatment available for the AIDS, but medication AZT is given to the HIV positive person. There is no vaccination available. Prevention is effective method, safer sex, healthy lifestyle, and the education about risk behavior of the AIDS. The World AIDS Day designated on 1st December every year since 1988.